Hello.
Hello, welcome. Hi, how are you?
Pretty good. How are you? Thanks for having me.
Good to see you.
Good to see you.
Awesome. Okay, really quick before we get started, I'll let you get settled there. And then for everyone that is watching, welcome. We're so happy to have you here with us again today. Really quick, let me just get out of the way and say the information provided in this live is for educational purposes only, and it does not substitute for personal medical advice. We advise all users and watchers to consult a local medical professional or healthcare provider if you're seeking medical advice, diagnoses, or treatment. So, okay, now that we have that out of the way, welcome everyone to another episode of Derm Talk. It's been a little bit. We're so glad to be back. We wanted to definitely have another one before we wrapped up 2022 and got into the new year. So we're so happy to have you all here with us and to have you, Dr. Ruth Jobarteh Williams. Welcome back. It's so good to see you.
Absolutely. Thank you for having me back.
Good. How have you been?
Pretty good. Surviving.
Right? Aren't we all? Aren't we all? It's all we can do. Okay, really quick too, before we get started, just wanted to say that for anyone who's new to these segments of Derm Talk, what they are is they're a lot of fun. We basically sit down with a dermatologist from our dermatology advisory board, and we talk about all things skin, whether it's skincare products, skincare concerns, skin types, you know, how your skin changes with age or year, whatever it is. If it has to do with skin, we talk about it here on these segments. So that's what these are all about. And it's a great time too to kind of interact with you, the people who are watching, and ask questions. If you have questions about either our product specifically, or if you wanted to ask, you know, the doctors and the dermatologists that are here certain questions, this is a perfect opportunity. It's really fun and really interactive and very informational. So we learn a lot and they're a lot of fun. So welcome. Glad to have all of you guys here. Okay, so again, our amazing guest who's with us today is no stranger. She has been on here before and we love her, and thank you so much for being here again. Dr. Ruth Jobarteh Williams, she's a board certified dermatologist based out of Maryland. So how is the weather out there? Is it cold? Or you have snow?
Cold. No snow yet, but it's pretty cold.
Okay.
But I would say for December, it's actually not that bad.
Nice. All right, so a mild December.
Absolutely.
Can't complain. Good. Well, like I said, we wanted to have another one of these segments before we wrapped up 2022 and, you know, got into the new year. And we thought the perfect topic for today's segment would be, okay, skincare in 2023. What does that look like? Like, we know 2022, you hear all of these, you know, new hot trends or new products and ingredients, things that are like super buzzy in the moment. You never know what's like really good and what's going to stick and what you want to carry with you into the next year. And those things that you're just like, okay, it's time to leave those behind and move on. So that's kind of what we're going to talk about today. We reached out to our Facebook community group. And for those of you who aren't part of it, oh my goodness, you definitely want to be a part of this group. It's there's a lot of people in there. It's very supportive. It's very it's just a great community. It's really great community to talk about just, you know, taking care of yourself and your skin and how to go about that. So we reached out to all the people in that group and kind of got some questions and kind of what people were wondering about and thinking about. But before we jump into those, I want to ask you, what are some things that you saw in 2022 that you're like, okay, it's time to leave those here and move on to something new? Was there anything like that were like super buzzy trends or anything? There things that you maybe saw some of your patients doing a lot of that you're just like, no more?
I would say the vampire facial that people are doing.
Oh yeah.
Their menstrual, you know, blood from their menstrual period for a facial.
Mm-hmm.
When I think about it, it makes me a little bit uncomfortable.
Just a little bit.
I know. It's just like, well, I don't think we need to take that into 2023. We have a lot of products on the market that can do what you're potentially trying to achieve. So definitely no need to put menstrual period on your face. That should be 2022 and that's it.
Stay there. Bye.
Stay there.
No, that was super trending. And I mean, you saw it everywhere and you heard tons of people doing it. And
Absolutely.
Okay, so that's one to leave. Okay, great. Good to know. Anything maybe that you've heard of lately that's kind of new, or maybe not even new, but just something that you're like, absolutely, no matter what, everyone needs to be doing this in 2023?
I think if I were to choose, I would say using a retinol or a retinoid. And I think it's because we've studied this for so many years. We know all the benefits. It does a lot of, a lot of things for our skin. And I
Mhm.
would say if you're not using a retinoid and if you're not pregnant or you're not breastfeeding, that would be something you might consider incorporating into your skincare routine for 2023.
Okay, so retinols and retinoids, you hear a lot about how they're great for like anti-aging, for wrinkles, fine lines, and all that kind of stuff, but it's really good for acne sometimes too, right?
Yes, it is. If you were to see me in clinic for acne, you have to be on a retinoid. If you're not pregnant and breastfeeding,
Right,
obviously,
of course.
you have to be on a retinoid.
So it's
Because if you think about the way acne forms, you have to target a part of acne that, helps the follicles just flourish and just do what they need to do without getting clogged. And retinoids do a really good job of that. That's why it's so important.
great. So unless you have like super sensitive skin, pretty much anyone can use this, unless you're pregnant, of course, too.
Even if you have sensitive skin, there is a way to incorporate retinoids into your routine, so it's not a no-no.
Actually, we have a question about that. That's funny that you say that.
Yeah.
Somebody had asked about different methods of using retinols and retinoids and all that kind of stuff. And one of them was for sensitive skin. And they talked about the sandwich method. I'm sure you've heard about the sandwich method and what that is.
Yeah.
Is that a good method to use? Is that something you should use if you have sensitive skin? Is there a better way to go about it?
Absolutely.
And maybe actually first you can explain what that is for maybe those that don't know what
Okay.
it is.
So it just means that you're making a sandwich with your retinoid. So what I usually recommend is you cleanse your face, you apply a moisturizer, you wait for about 10 to 15 minutes, and then you apply a pea-sized amount of your retinol onto your whole face, apart from the areas that you would avoid, like around your eyes.
Right.
And then you apply a moisturizer on top of that. So if you look at it, it's a sandwich. You have a moisturizer, you have the retinol, and then you have the moisturizer on top. That's how you call it a sandwich. And it's a very great way to introduce your skin to retinoids if you're not used to it. I always put my patients on that regimen. Even if they have oily skin, I tell everybody, if you're new to retinoids, start with the method and see how your skin tolerates it. And if you're fine, then you can just skip the last step. But I always just recommend that.
Awesome. Okay, good to know. So it does work, actually. And another thing that some people do too with retinols when they first start, we've heard about, putting it on, waiting like 15, 20 minutes, and then kind of washing your face again, just so that it doesn't get that irritation. Does that actually work, or is it kind of defeating the purpose of putting it on to begin with? Is that enough time for it to do its job?
I think it's called the short contact therapy. It does work, but I think eventually you have to transition to just leaving it on your skin. But I think it's a good way to introduce your skin to retinoids. But, even for all my patients, I typically go with the sandwich method and not the short contact therapy method.
Right. Okay, yeah. I think that makes sense too. Moisturizer first is going to kind of cushion it a little bit if you want to put it that way. And then you have your moisturizer on afterwards too. So that's good. Okay, ingredients. Now we hear, there's new skincare products coming out all the time. You hear about them everywhere, all over social media, the trending ones on TikTok, all this kind of stuff. But for 2023, I know you said retinol obviously is number one. If you're not using it, it's something that you should use. Are there any other ones that you would say are like a must-have for 2023? If you're not using them now, now's the time to start.
Must-have. I mean, you can't have a retinol without having sunscreen. So, and there's still quite a few people who are now wearing sunscreen. So if I were to pick one, I would say sunscreen.
Absolutely.
But other ingredients that I love that I think they're going to get more popular in 2023 would be tranexamic acid. It's just very great for treating hyperpigmentation. So, and I think that more people are starting to learn about it now. So, might get more popular in 2023.
Great. Awesome. Yeah. Going back to the skincare or the SPF, I mean the sunscreen, everybody needs sunscreen.
Absolutely.
How old you are, what your skin type is, what your problems or concerns are. It is something that every single person needs. That was actually one of our questions that we had in here too. Somebody was asking about sunscreen. And I know that a lot of people don't wear sunscreen if they're not going outside or they're not going to be indoors, or if they live in a really cold, kind of cloudy place. They're like, the sun's not even out. I don't need it right now. So the question basically was, is it necessary to wear broad spectrum sunscreen, rain or shine, indoors, if there's no sun out? Like, is it still necessary to wear SPF?
My answer is yes, if you're going to sit by the window, because the UVA rays, even though you don't really see it, it's still there and it's penetrating through the window. But if you're not going to be by the window, you're pretty much sitting in the four walls, no window, then I would say no. But also, a lot of people work from home now, and they're always on their computers, their phones, and we're starting to learn more about the blue light and how it, affects our skin.
Right.
And I think that if you're going to be in front of the computer, I just recommend using sunscreen as well, just because we don't know how much it affects the skin. And the thought is that blue light, worsens hyperpigmentation, which a lot of people suffer from. So that would be my recommendation. And I also tell people, if you do it every day, then you never really forget when you need it. So it's just part of your day-to-day routine. So why not?
Absolutely. No, I think it's so important. And that's why I love ours too, that we have so many ingredients in there. It's like a moisturizer as well.
Exactly.
It's a moisturizer with stuff that protects you. So either way, you're getting the benefits of both. So it's like, protect yourself, and a lot of people don't think about the computers, like you said, and the blue light and all that kind of stuff, when those make a difference as well.
They do.
So it's really something to think about. Everyone's on their phones or their computers or something almost all the time. So definitely something to think about. Now, with the sunscreen, does it make a difference, or is there a benefit to one over the other, like regular, like white sunscreen versus a tinted sunscreen?
It depends on what you're trying to treat. So in people that suffer with a lot of hyperpigmentation, I always prefer to recommend tinted sunscreens because they contain iron oxides that also help you, help you with pigmentation issues. But I think overall, like, when you think about chemical versus physical sunscreen, I think that if you're not allergic to a chemical sunscreen, then go ahead and use it. The issue with the physical or the mineral sunscreen is that if you're a person of color, sometimes they give you that chalky look. And one way to kind of, dance around that is by using the tinted sunscreen. And also, like, if you're pregnant, we do know that the chemical sunscreens are absorbed to some level, but we don't know the critical significance of the absorption. So if you want to play safe, if you're pregnant, I just recommend 100%, physical mineral sunscreens.
Right. Okay, great. Now, someone had asked too, and this isn't something that you think about a lot, because when you put sunscreen on, you put it on your skin, like all the areas that are exposed. And someone asked about like on your scalp and in your hair and things like that. And basically, is that something that you need to think about, like with your sunscreen? Is it something that you need to, is there certain products that you should use for your hair, or is your hair enough of a protection from those rays to kind of protect your scalp?
I think right now, the only situation or scenario that I recommend sunscreen on the scalp is for my bald patients, just because their scalp is just really exposed to the sun, and people can develop skin cancers on their scalp. If you have like, a head full of hair, like I typically don't really recommend sunscreen to be honest. I don't. Yeah, not really.
Okay. So it's kind of enough. Okay. Kind of moving on to the body, let's say, even, because I mean, skincare doesn't just apply to your face, it can also apply to your body as well. So someone was asking, when it comes to moisturizing, like this is a question for both your face and your body, but it says, do you need to moisturize, number one, your face every day? And then do you need to moisturize your body every day too? Is that something you can maybe just do every couple of days, or is it something that every day you need to be putting some sort of moisture?
As long as you're taking a shower and you're cleansing your face every day, then you should be moisturizing every day. Just because you want to replenish that, the moisture your skin is probably lost from the cleansing process. So my answer is always yes. And I think this is very important because a lot of people with oily skin just have this misconception that they don't need a moisturizer, and that's false. Even if you have skin, you should always use a moisturizer. You just have to find one that would not make you look greasy or have that, the fillings that you don't want to have in your skin.
Absolutely. Yeah. That's why our water cream moisturizer is fantastic for people that have oily skin, acne prone skin. It's actually made for people like that.
Absolutely.
It's not going to make you greasy. It's not going to make you more oily. Like you said, there's this huge misconception, and there's a difference between dry skin and like dehydrated skin versus oily skin. And there's a huge difference. So yeah, that if you do have like acne or oily prone skin, definitely check out the water cream moisturizer. It's really a great product.
I like
Even if you have regular normal skin, it's great for you too, but especially if you have like that acne prone or oily skin.
And also, if you have eczema or really sensitive, easily sensitized skin, definitely use a moisturizer every day, because if your skin is dry, you're going to flare. And this is the season where a lot of people are flaring with their eczema because it's really dry outside and the air is cold. So definitely want to moisturize every day. Sometimes I recommend moisturizing twice a day if people are flaring really bad.
Okay, yeah, and like you said, with the seasons being colder and drier, your skin, it wreaks havoc on your skin sometimes. And it's kind of shocking, if you go immediately from this like warm kind of, warmer climates, there's a little bit more moisture in the air, to just, cold temperatures, everything's dry. And yeah, I noticed a huge difference in my skin in the wintertime. So yeah, definitely something to consider. I know you had mentioned when you are like taking a shower or washing your face or something like that, you definitely want to moisturize afterwards just to replenish that moisture that you lost in the cleansing process. Someone had asked, they have dry skin already. And so they said, is it really necessary to wash my face twice a day? Do I have to wash it morning and night, or is it going to be too much for dry skin?
It depends. I think it's just important to choose the right cleanser for your skin type. So if you have dry skin, you want to use a hydrating cleanser. You want to use something that's going to make your skin drier. If you have, oily skin, you want to choose a foaming cleanser. So even if you have dry skin and you're using the right cleanser, you can do it twice a day. But occasionally, some people just don't choose the right moisturizer, and they're like over cleansing their skin, and they're just activating the dryness. I just think it's just important to read the label of the bottle. But also, like, if you don't wear makeup, I'm a big fan of twice a day. Like, even if you have dry skin, I'll always tell you to wash your face twice a day, because, going out during the day, the dirt, the air is dirty, everything. You just want to just remove that, layer of dirt that you might have accumulated day. And also your skin just replenishes itself at night. I just think it's just great to give your skin the environment and the nutrients it needs to really, thrive. So
Absolutely.
I'm a twice a day. Just find a cleanser.
Yep. Like you said, at night, I mean, even if you don't wear makeup, like you said, number one, you should be wearing sunscreen no matter what. So even just washing that off of your face, clearing out your pores, all the grime from just the day, your body all day sweat. You have this buildup that happens in your pores. You want to clean that out. And then it's a really good point. When you're sleeping, your skin's still working. Your body is still working. Absolutely. You know what I mean? So even though you might be sleeping, your body's not. And so it is. It's replenishing. It's doing all that stuff. You just want to cleanse your face in the morning, and then it just preps your skin for the day, for your morning routine, all your serums and moisturizers and stuff like that, just gets it ready.
And if your skin is too dry, you can also use a micellar water to cleanse your face. You don't have to use a traditional cleanser. That's another option too. And a lot of micellar water, you don't even have to rinse it off. Just, wipe it off, and that's it. You can apply your skincare products afterwards.
Okay.
So,
nice. Okay. We were kind of talking about the body for a little bit, moisturizing, the body, the face. I kind of want to get back to that a little bit, because like we said, skincare applies to the whole body, not just the face. So some people were asking, when you're moisturizing your body, obviously you see yourself every day. You'll see little things pop up, you know what I mean, if you see a little spot. And so someone was asking, okay, when when I'm doing that, how do I know if something is a mole versus just a freckle? Or what's the difference between the two, and is there a way to tell what the difference is?
I think that most people do not know the difference. That's why it's very important to see a dermatologist if you're confused about anything at all on your skin. But in general, freckles are typically flat, but a mole can be flat or raised. Freckles usually get worse in the summer because you're tanning and you can see more freckles in the summer. But usually the moles don't change that much in the summer. But I think an important difference is a mole sometimes can have a malignancy or a chance to turn into a cancer at some point, but freckles pretty much never turn into cancer.
Right.
And I think the best way to kind of know the difference would be, are you getting in an area that's sun exposed, like your face, like your arms, if you're wearing short sleeves in the summer? Most people are, not everybody's born with a mole, but people develop it throughout their life. And then for freckles, they tend to fade after the summer for most people too. But I would just say it's just important to just see a dermatologist. I always tell people, let the dermatologist tell you it's okay. Just assume it's a freckle when it could be a mole, because it can look similar sometimes to a regular person.
Right. Yeah. If you're not sure, definitely get it out. Always better to be safe than sorry.
Absolutely.
Okay. What if you don't necessarily see something on your body, like something that makes you say, oh, I need to get this checked out? Just on a regular basis, how often would you recommend someone going to see a dermatologist?
If you've never seen a dermatologist before and you're like in your 30s, I think it's a good time to start. Also, like the family history. If there's a family history of melanoma, you're somebody that probably wants to get plugged in with a dermatologist, so that way you have regular skin checks. I typically just recommend if there's nothing wrong, just once a year. It doesn't take that long to just do a total body check.
Yeah.
Also, it just depends. It's very, it varies from person to person, but I would say like if you're in your 30s and there's no family history or you have family history, it's a perfect time to start. Yeah.
Okay.
And I also think that we recommend like doing your personal skin checks, but I think that it's a very difficult thing to do because you can't always see all the parts of your body. Like it's really hard to see the back. Even if you're using the mirror, you can't always see everything on the back. And also sometimes like we dermatologists use a special instrument called a dermatoscope to look at moles. It's more like a fancy magnifying glass. Sometimes things look normal, but when you look at it with the glass, it looks a little different. And we recommend doing a biopsy, which is just to take up the mole.
Right.
But yeah, so a regular person can't really see that. You can't really see beyond what you're looking at. So yeah.
Oh, yeah, it's very important. Like we said, if you have any question or any doubt, please play it safe and just go see the dermatologist, have them check it for you. Better to be safe than sorry. All right, we're gonna kind of jump back, I think, to the face. We had obviously most of our questions are gonna have to do with hair and your face. So we're gonna kind of hop back there for a little bit. Lots of people are kind of wondering about obviously skincare, and there's tons of products out there, like we said. I mean, all you have to do is scroll on social media, be bombarded with companies and products, and you have to use this and you have to use that and all this kind of stuff. So is there such a thing as too much? Like, can you overdo it on your skincare and like actually do not necessarily harm, but to almost to a point where it's not doing anything, like if you're using too much?
Yes. And I think I blame social media for that. I think they make it look like you need to have 10, 20 products in your skincare routine to have good skin. And that's not true. That's not true at all. And I think that using too many things sometimes really just damages your skin because people start to over exfoliate. They don't even know they're combining different actives in their routine. They're combining this acid, and they get so irritated. And irritated skin actually tends to break out more than regular skin. So yeah, definitely you do not need 10, 10 things in your skincare routine. You can definitely overdo it. Yeah.
Okay. If there were some that you said, like outside of obviously like a cleanser, an SPF, retinol, like we were talking about earlier, are there other things that you would say, look, you don't need, 10, 15 products, but these are like a good kind of core ones that you think are kind of good for most people that would help, let's say, with anti-aging or something like that, just a good kind of solid skincare routine?
So for the morning time, what I always recommend is a cleanser, a vitamin C serum, because vitamin C is a very well studied antioxidant that really protects your skin from sun damage.
Right.
So, vitamin C, a moisturizer, and sunscreen. That's it for the morning. You can also add like things like niacinamide. Niacinamide is a very good anti-inflammatory.
Yeah.
Really just helps to calm irritated skin. So I always recommend it a lot. And I like the one by Dermatology, which is the needleless serum. It's a combination of hyaluronic acid as well as niacinamide. I personally use that in the morning with the vitamin C and my moisturizer and sunscreen. That's it for the morning time. And then the good nighttime routine would be a cleanser, a retinoid, and that's, and a moisturizer. That's all you need for nighttime. So if you're counting like cleanser, vitamin C, plus or minus, niacinamide, SPF, your retinoid, like it's like 5 to 6 things. That's all.
Yeah. And that's for morning and night.
Yeah,
like,
absolutely.
Yeah.
And you're not using them at the same time, and they're things that you're going to get results from because we have studies to back them up.
Right. Yeah. The good thing about the vitamin C, like you were saying too, it really helps kind of like even out your skin tone. It just bright. I love using my vitamin C in the morning because I really know a huge difference in my skin. It really does just give it a brightness to it and a little bit of a glow. And honestly, I kind of switch depending on the year and kind of where my skin's at between either the vitamin C, E, and F serum that we have. And then we also have our vitamin C5, which is kind of like it's like a moisturizer type vitamin C, but it's got 5 different types of vitamin C in there. And I love that one. That's kind of been the one I've been like on a kick on lately. So like I said, I go back and forth, but like we have 2 options and they're both.
And that's really the one I use as well, just because my skin does not like the L-ascorbic one, which is the most popular one and the most, the most studied one. But my skin just does not like it. So I use the vitamin C5, which is the THD one. And and I recommend it to a lot of people with easily sensitized skin too.
Yeah.
Because it's very tolerable.
Yeah, I love it.
Gives you the
like I said,
looking
Yeah,
for.
I love that one so much. Okay, kind of going to the exfoliation part. We just talked about it. Like so many people with all these different products don't realize all the different ingredients and actives that are in them. And a lot of them are exfoliants. So let's talk about exfoliation. How often should someone exfoliate?
It depends on your skin type.
Okay.
If you're somebody that has dry skin or easily sensitized skin, I would say, once every 2 weeks or once
Mm-hmm.
every 3 weeks. If you have oily skin, most people with oily skin can tolerate it like 2 to 3 times a week.
Mm-hmm.
But regardless of your skin type, I always recommend starting like, once a week and see how your skin tolerates it. And then you can increase the frequency if there are no issues. Um, and this brings me back to the whole like skin cycling thing. I do not like it because I feel like it's just, I get it. I think the whole premise is to encourage people not to over exfoliate. But then if you look at the routine, they're using the retinol like maybe once a week or, once a week. And I feel like with retinols, you're not going to see the benefits you want if you're not using it frequently. So I recommend like using a retinol more than trying to adding all these exfoliants into your skincare routine, because that's what really can give you that benefit you're looking for.
Absolutely. So kind of talking about that skin cycling, can you explain what that is a little bit, maybe for someone who doesn't know what that is?
So it's just this, I think it started from TikTok, I'm not sure. But it's just the whole premise is for you keep your morning routine as the way it is, but nighttime you alternate between an exfoliant and a retinol. You kind of do your exfoliate, use your retinol, you exfoliate, then you skip like 2 or 3 nights and just hydrate your skin. And I get it. It's just to encourage people or remind them that you should not be exfoliating or using your retinol every night. But personally, I think that you end up using the retinol like once a week. And I think that you're not going to see the benefits you really want if you're only using it once a week. So in my opinion, I would rather you use your retinols more and reduce your frequency of the exfoliant, or just skip it in general, because not everybody really needs to exfoliate their skin, and I think people don't get that. But absolutely, if you want to exfoliate your skin, it doesn't have to be an everyday thing. You can do like once a week. You can do twice a week if you have oily skin and your skin can tolerate it. Otherwise, just listen to your skin. Slow and steady wins the race with skincare.
Yeah, absolutely. We talked about kind of how your skin can change with like the weather and seasons and things like that. What about diet? Someone was asking, can diet really affect my skin? Like to the point where you're going to notice a difference? How does diet play in with that?
Your diet affects you as a person, including your skin. And I think in dermatology, so far, they've only mentioned like skimmed milk. But other things like whey protein, whenever I see people that exercise a lot, I want to make sure they're not on whey protein because I know it does trigger acne, people that are acne prone. But doesn't mean that everybody that, takes all of it or eats like unhealthy things experiences acne or bad skin from it. It just varies. But some people are just so more prone to it than others. Other things that people don't even know, like some vitamins like vitamin B12 can also make your breakout in some people, and vitamin B6 as well. So for me, I just, tell people if you have acne prone skin, yes, maybe some things can make your acne worse, but doesn't mean that whatever you're ingesting is the primary cause of your acne. So I think it's just important to know that.
Yeah. Like everyone's skin's different. Everyone's going to respond to things differently. So, great. Someone was asking, kind of going back to acne, because a lot, people think, oh, you eat greasy foods, you're automatically going to break out in acne or things like that. And that's not necessarily the case for everyone.
Not the case for everybody at all.
Yeah. But somebody with acne, they had acne scars. And so they were asking what product, like what dermatology product actually works best for old acne scars. So there's something that's going to take away old acne scars, or what would you recommend for something like that?
It's really tough because I think you have to, because when people say scars, sometimes they're talking about, pigmentary changes.
Right.
But if you're really talking about the scar, where there's like a divot in your skin, it's really hard to take that away with any cream or ointment or any lotions. The only thing I would say that in the long run can give you benefits would be a retinol, because in the long run, it helps to boost collagen production. But most times when you have the buck scars or like the divots in your skin, you likely want to get a cosmetic procedure to help you break up those scars and just tighten your skin some more. But I would say definitely a retinol would be my recommendation, but more than likely would need a cosmetic procedure, like microneedling, some laser therapies can really help as well.
Mm-hmm. Yeah, one thing that I've seen, one of our products that someone had used that did have, they weren't, I will say they weren't severe like skin, scars, but
Right.
she did have some very untextured surface on her skin, was the Advanced Retexturizer. And she used that and saw phenomenal results. I think we might actually have some before and afters.
Right.
I'm not sure, but they worked phenomenal. For me personally, I didn't have the bumpy, untextured type of acne scars, but as I started to get older, I hit my 40s, I started to get hormonal acne. And when it lasts a long time, and then when they go away, it was leaving dark spots on my face. And so that's what I was struggling with. And I started to use the Advanced Retexturizer as well. And that was the one thing that really, really helped kind of just even that out and kind of get rid of that. So yeah, that would probably be a great thing for somebody to try too. Again, if it's something like that, if it's like super severe, it's not going to take it all away, of course, but I've personally seen some great results from it. And I know that other people have too, that did have that uneven skin texture. That really, really helped. So, oh, here's one about kind of going back to the retinol. Somebody said, should I be using retinol and tretinoin together? So can you kind of maybe tell what the difference is between a retinol and then a tretinoin, and then if they should be used together or separately?
Right. So just starting with the basics. So the umbrella term is retinoids. So under that, you have the retinol, the retinol, the retinaldehyde, and the retinoic acid. So every retinol or like I guess retinoid product that you use, the active form in the skin is the retinoic acid. So a retinol needs to be converted to a retinoic acid in this for it to work. So as you can tell, that has like a few steps before it gets to retinoic acid. So, but a tretinoin is already a retinoic acid. So it's the form that your skin needs to function. That is why it's more effective. It doesn't have to go through steps to get converted to the active form. It's already the active form. But the downside to that is it can be irritating. A lot of people get that flaking, that burning of the skin initially. But with retinols, because they are gentle, they're not as potent, and so you have to go through all the steps before they get to the retinoic acid, are not as effective. Doesn't mean they don't work. They just take a little longer for you to see the results. So should you use both at the same time? The answer is no. If you have access to a tretinoin, which is a retinoic acid, I would say use that over a retinol, because one, you're going to get faster results because you have to convert it to anything else. Yeah, and it really works really well.
Great. Yeah, that's really good information, because you hear those words a lot, and like everyone should be using a retinol, and they're like, oh, but tretinoins are better. And so not knowing exactly what they are and the differences, and if you should be using both. Thank you for that. That's really important.
Another thing would be that you can get retinols over the counter. Most times a tretinoin or other retinoic acid, you need a prescription from a dermatologist or your PCP to be able to get that, and that's the biggest difference.
Right. Yeah, no, that's absolutely true. Okay, we had so many questions come through. We're going to get to a couple more before we wrap it up. But there's been so much. If anybody posted questions on here that we haven't gotten to yet in the comments, please know we will get to you. They won't get ignored. I promise we will get you an answer. So still drop them in there. If you have questions, still put them in there, because one way or another, we'll get back to you. But just a couple more before we wrap it up for this segment. Somebody asked me this question, and I feel like I've heard this for years. And so I'm wondering, if it's still out there. And apparently it is. Somebody was saying, can I use lime or lemon on my skin? And that's all they said. And I know it has to do probably with those spots, but you please tell us, could anyone be using lime or lemon on their skin?
No, the answer is big no, no. If you actually put lime or lemon in your skin and you go in the sun, you can get a skin rash from it.
Yeah.
So, no, please. It damages your skin. The acidity of that is just not great for your skin at all.
Right. Absolutely. No, I had a friend who had squeezed limes in her kitchen, and then she went outside and her entire hand blew up and got a huge, terrible, terrible rash. So yeah, please, please, please don't put lime or lemon juice on your skin, especially if you're going out in the sun. Okay, just a couple more. Oh, somebody was talking about vitamin supplements. So here's something I think is really good. Starting a new year, everyone starts New Year's resolutions. Some things want to be, you know, starting to really take care of yourself. A little bit of self-love, some self-care, do better by your skin, your diet. And a lot of that, I think, comes into play too when it talks about supplements or vitamins or things like that. But somebody said, I take vitamin supplements and I break out all the time. Do you think it's the vitamins that I'm taking that are possibly affecting my skin? So are there vitamins and actually things you're taking that you think are good for you that could be having an adverse reaction to your skin?
Absolutely. So like I mentioned before, vitamin B12, vitamin B6 can make people break out. So you probably want to check the supplements and see if they contain those ingredients. That could be the reason for your breakouts. But at the same time, if you're deficient in vitamin B12 and you're supposed to be on supplements, I would not recommend discontinue it without talking to the doctor, because you have to kind of weigh the risk and benefits. That'll be something that I would watch out for sure.
Okay, yeah, and even like you were talking about earlier, whey protein. You know, you think I'm going to start taking these protein shakes, I'm going to be really healthy, but you start using all this whey protein, and that can sometimes have, you know, a reaction too. So just, you know, be aware, I think, of what you're taking. And if you notice a difference when you start something new, kind of either talk to your doctor, kind of, you know, take time to like really see what's happening with your skin when you try something new. So that's really important.
I think also break out with biotin as well. So that's one thing that I've seen a lot. And I think biotin got really popular last year, this year for hair loss. But now we're trying to educate people that, you know, if you're not deficient in biotin, you don't need to take biotin supplements, because it's not going to help your hair.
Right. Yeah, no, that's true. It's very true. And that was so hot, like you said, all over social media last year. I thought so. Yeah. Yeah, and I think that's the last thing too before we wrap up. I think we should really make it known and please everyone, just because you see something out there, see something trending, please do your research, you know, and really study it and find out if it's something that's going to really benefit you and if it's something that's going to be good for you, because they're not always going to be these great answers, something that's going to, you know, apply to everyone. The shoe doesn't always fit every single person. So just do your homework and do some research and talk to your doctor before you jump on the bandwagon of all the trends.
Absolutely.
Let's take that into 2023. Let's not jump on all the trends. Let's do some research and study it all out, and make sure that we're doing everything possible to really, really take care of our skin and ourselves. And yeah, that's great. So I think we're going to wrap it up for this one. This was our last Derm Talk of 2022. Thank you so much for being with us today and to help us wrap up the year. It was good to see you.
You too.
And we will see you next year. Thank you everyone for coming and for watching. Again, please, if you left questions in the chat that we didn't get to or in the comments, we will definitely get back to you, promise. And for everyone watching, happy holidays. Thank you so much. It's been a fantastic year. And we just want to say thank you to everyone who has, helped us grow and been part of our family and our community. You've all been fantastic. So Dr. Ruth, it was fantastic to see you. Thank you again.
Thank you for having me.
Absolutely. Everyone watching, have a great night. We'll see you next year.
Bye.
Bye, guys.